So that's it.
All right. Welcome everybody to our virtual webinar once again. I'm here with Jamary, my nurse practitioner extraordinaire, and Amber. We have to say we miss you, darling.
We miss you.
But we're having fun.
We are.
But we still miss you. You need to come back down and join us again.
That's right.
So tonight we're going to talk about jawline and neck, and we're going to talk about rejuvenation and rejuvenation.
That's right.
And we're just going to kind of chat things up. I'll be putting some slides up there of some before and afters and a few little factoids. But for the most part, we want you to join us. We're sitting in front of our empty 41-seat red velvet chair theater. And missing you all. And
hopefully soon we'll get to have you guys in here and do these in person again. But for now,
let us know what you think. I've thought about maybe having a little VIP where when we do these, we can invite 5 people to come and be our little studio audience.
Yeah, that would be fun.
Let me see what you guys think about that. You know, kind of answer us and see if you'd be interested or if we're kind of pushing the envelope. What you think, but I thought 5 people in 41 seats, I think we'd be able to social distance nicely.
Absolutely.
And then it would give us a little more energy from you guys.
Yeah.
But please ask us questions. Tonight, our secret code is balance. So if you call up the office anytime before 5:30 tomorrow night, you will get 10% off all therapy, radius, renew cool laser, Neuromod, and Bellatero, all related to the jawline and neck.
It's amazing,
a lot of things.
That's a lot of products.
It's
I don't really get that very often.
So, just give us a call, but you have to call and say, balance. All right, so we're going to talk about, that was my welcome.
Yay, welcome me.
Yay. Yay, Jamary, we forgot the champagne.
I know, next
Where
time.
is it? Next time. Next time we'll do some nice hard champagne.
There you go.
So we're going to talk about jawline and neck, and we talked about this, even a lot of my patients come in, their faces are great because they've been coming to me for like 10, 15 years doing everything. And then I forget about their jawline sometimes, not usually jawline, but a lot of times their neck.
Yeah.
So I don't want you guys to forget about it, and that's why I'm bringing it up.
It's an area just like our hands too that shows just as much age. So we can't neglect it. We have to make sure that we try and match our neck to our beautiful faces that we have.
And it's all about balance too,
Absolutely.
because you don't want to go out and everybody's like beautiful, and then you take the gorgeous silk scarf off and they're like, oh, ooh, she's older than I thought. No.
Like we're looking 50 here and like 70 here. It's not a good look. We need to match it.
All right, so then we've got our secret code, and I'll keep flashing it up so that you can hear it. Can everybody hear us? Okay.
And we need to project.
Yes, I'm not good at.
I'm Cuban, so I have no problem with that. I'm pretty loud. Usually, I'm too loud.
You can project for me then. Encourage.
At least that's what my mom tells me. Stop yelling at me.
So when we're dealing with like sun damage and treating the neck and lower face, I kind of like to talk about my firm, fill, and finish, which you all haven't heard me talk about in a little while. So in firm, we're talking about like the double chin. We were just talking about that. We're talking about laxity and treating that extra fat. And then fill, we're usually talking about filling to make that beautiful jawline.
Right.
You're good at. Very good at. And also filling these necklace lines. That's really fun.
Mm-hmm.
People look like they got strangled, but it's okay. It's only temporary.
Yeah, it gives great results too.
It's instant gratification with those necklace lines. And then we're going to talk about finishing, so getting rid of sun damage and spots and things like that. So we're always going to talk about those things. So firm.
Lovely picture, right?
I actually did have a patient of mine once who came in and she said, my neck is very lax, and she was able to pull her neck out like this. I mean, it was, so when I saw this picture, I'm like, oh yes. And I probably have some other patients who could, but they don't do it.
But I think it's such an accurate, description of what a lot of patients suffer with, and they don't they know that it's a problem, but they don't even know what options there are available to actually help. So
you're right, like, or they don't think there is anything.
They think there's
nothing for it except for surgery. And we are here to tell you
that's not true.
we have very nice non-surgical options. And if there's a patient who truly is not going to benefit from anything I do except for surgery, I'll tell them, and I'm sure you will too.
Absolutely.
That, hey, you know what? I can do things for you, but you should go have surgery. Now, a lot of times I have patients who tell me, I'm never having surgery, so then I go, okay, you're not having surgery, here's what we can do then. So, my answer to this patient was, stop doing that. You're making it worse. So our firming things, we have all therapy.
Yes.
And all therapy is the only machine out there that will lift. And you've probably all heard me say that a few times. It is a single treatment. There is no downtime. And I'm not going to tell you it's painless because it hurts. But we do have our Pronox, which
yes, absolutely. You get a little buzz while you're having your treatment, so that really helps kind of take the edge off.
Yeah, it really. And since we've gotten that, I rarely have patients complain or say, "I'm not going to do that again."
It's completely intolerable. Yeah,
it's nice. So that is a machine again, single treatment, no downtime, and I never talk about doing the neck alone. And basically, because it doesn't make sense to lift your neck. A lot of times you can get nice lifting by treating the face and the jawline. If you look at my neck, not Jamary's, because it won't change anything when she does this. If you watch me do this and look at my neck, improvement?
Improves, it lifts. Absolutely.
Yeah, so I mean, before we ever start doing anything directly on the jaw, on the neck, I treat jawline, and that's kind of why I put them together.
Absolutely.
Because you can do a renew lift, and you can, if you put enough product up there, you can actually suck up under that jawline. Like that gentleman we looked at his picture.
Oh my gosh. She did a male patient last week, and his results were amazing. I mean, he looked like 10 years younger. Yeah. It's funny because men, I mean, it's so typical, right? Men age better and they respond better to stuff. They lose weight faster. I mean,
we hate them.
We don't like them.
So we've got our firming with the alt therapy. We can also do with the Renew Cool laser, which is our fractional CO2 laser. It is 3 treatments. They're done 1 month apart. You will have a little downtime, redness, and especially the neck can be a little redness and swelling. Yeah. But a nice scarf goes a long way.
Absolutely.
And then, you can be out and about. We say after 24 hours because you can't wear your mask. But that's it. And it's going to help, that creepiness. Yeah. Where it may not even be lifting, it's more tightening and creepiness. The Renew Cool laser I can't even believe the amount of tightening we're getting.
We're getting some really great results. Patients are really loving it. I mean, before, like she used to say, she would do like the CO2 laser maybe a couple times a week, and now we're doing like up to 8 a day. So, I mean, you guys definitely are loving it, and you're coming back for more. So, I think it speaks for itself.
It's really like a game changer.
And if you haven't looked at our Instagram, you should scroll down and check out some of our before and afters, because you can just see like the patients look so much brighter and just like this youthfulness about them. It's like you can't really pinpoint what it is, but you can definitely notice the difference.
Yeah, I don't remember exactly what every one of my patients looks like, but I always know when they've had that laser, they just look refreshed, they're tighter, their skin, has less laxity. It's great. Yeah. So, and it lasts like 3 to 5 years, which is a long time.
Absolutely.
But I think what's going to happen, we haven't even had it a year, but I think
people are already getting addicted, and they're like, no, I want one at once a year.
Yeah, I think it's a great thing to do once a year. I'm due for mine very soon. So our last firming one to talk about is this.
DCA. Oh, yes. Love that.
If you can pinch any fat there or here, which I can.
I think most of us can probably. I mean, especially, I know for me, like I started to get my little submental double chin going here after kids. I always had a little bit before, but after my kids, everything kind of fluctuates in your hormones. It was definitely a lot more evident. So
yeah, things change after kids. It's
great. They're worth it.
It's wonderful. They're worth it. But yeah, it is an area, you can exercise it and stuff, and you can lose weight. But the nice thing about the deoxycholic acid is just some little injections that you do here. Literally takes like
super fast.
It hurts a little bit, but only for 10 minutes.
Yeah, it's short-lived. And it's not even hurt, it's like a burning sensation. It really dissipates fairly quickly. And we ice the area right after, so it really helps just to kind of calm that sensation down.
So the coolest thing is that fat is like immediately it's gone.
Yeah.
And permanently gone.
Absolutely.
Which there's very few permanent things that we do.
Absolutely.
So it's immediate, it's permanent. We recommend at least 2 treatments. So we sell it in packages of 2. Every once in a while somebody needs a third one. You know, I've had over the years, sometimes people come back like 5-10 years later and they've gained some weight. Now that it's not those same fat cells because they're gone, but maybe some other ones decided to
swell up a little bit.
So then we have to get rid of those.
Yeah. And you will have a little bit of swelling after because, of course, I mean, if you're killing fat cells in the area, what's the body going to do? It's going to swell. It's just its protective healing, mechanism. But this is a great time to do that because guess what? You have a nice mask to cover up that swelling so nobody will even know.
I honestly, with DCA, a lot of people put it off because they're like,
yeah, because you do swell. It's almost like a little bullfrog.
It can be. The more fat you have, the more swelling you get. And, it's like, I don't want to look worse, but this is the time to do it. You put that little mask on, it's covering it right up. I mean, it's like, it's the best time. It's the best time to do your lips, the best time to do your...
Yep.
It's great. So these are our firming agents. And I love this slide because this little bit about health therapy just shows the different levels of everything that it goes to. So the red arrow over there is our surgical lift, and the alt therapy is right there with our orange dots. And it's going right to that same level that surgeon's going to go to give you a facelift. And it's causing a little heat injury, and then as it heals, it tightens, and that's why it lifts.
That's awesome.
And that's why there's no other machine out there. And while we're doing it, we visualize that tissue so that we know exactly where we're putting that heat. It's better than anything out there. I am definitely a proponent, and you can see why.
Yeah.
This is, this is 3 months after 1 treatment, so single treatment, and nice jawline. Now, this would be great if you add a little radius to it, and
just define that
define it a little bit.
Yeah, I think I'm so glad that we're talking about this topic because it is something that just gets neglected so much. And, we know that as we age, our bones get smaller, our fat deposits get smaller, everything kind of starts to shrink, but we know that mostly to our mid-face, we forget here. And that's why you see a lot of women in particular, I mean, it happens to men too, they have this continuation from their face into the neck. There's no clear defined,
they lose
that definition. So this is fantastic when you can combine some of these treatments and really just regain that structure again. And it just adds such a youthful appearance back to the face and balance.
Balance. Our
secret
don't forget
code.
Balance, secret code. It is totally, and I see so many women that have been other places. And they come in and do filler in your, cheeks. Oh yeah, I do. And it's just, they don't look right because they've got, their Botox up here. They've got their, whatever they put in their cheeks. And then, they have no definition to their jawline. It's like face, neck.
Yeah.
Hello, face, neck. We want to go face, neck. Yeah. So a lot of times those women come and they've moved from another state or they've moved up from the south and they do 1 syringe of radius and immediately they're like, oh wow. It's because it totally is that balance.
And it balances out even that jowl area which for a lot of women this is what really bugs us because it just starts to get so heavy here, but when you kind of elongate this and define this, it automatically improves that tremendously.
Yeah, it just pops up. So then, we'll a lot of times radius is kind of the first thing that we'll do
for sure
because it's immediate. So radius.
And we're building that structure back up, and then we can start incorporating the whole therapy and all the other stuff for that lifting. But absolutely.
And the DCA. So if I lifted somebody with radius and I still see that little fat pocket there, then we say, okay, let's pop a little DCA. So it's never one thing, and that's, I think, one of the great things about coming to Renew.
Absolutely.
We don't have just,
it's not the same recipe for everybody. that's why the consultation process is so important, because you really take the time, to talk to you, discuss what your biggest concerns and, what bothers you most, and create the best plan that's going to work specifically for you. Because it's not one size, fits all for sure.
Right. That's why everybody gets their transformation plan. But even my patients who've been my patients forever, I think, come in and get your transformation plan for your neck. I mean, don't forget about it, because the longer you wait, the more difficult it is.
Yeah.
And it's not something you're going to have to be addressing yearly,
Right.
like your face. I mean, a lot of times the things we're talking about, you do once and you can
last for a while.
last for a couple of years.
Yeah.
But you want to do the rejuvenation.
Absolutely.
You don't want to wait until it's really saggy, like this neck up here. This neck, she probably was during, grew up in a time where there really wasn't anything.
When we used to put baby oil and iodine.
Yeah,
I did it too.
You just heard about it.
No, I did the baby oil with iodine. I did for a short time.
Girl,
I know. I paid for it though. I had my skin cancer before I was 30.
Yeah, it's awful, and that's the bad medical part of it, and then there's the bad
And
aging
then there's the bad
part of it.
aging. Yep.
So, and this is all therapy, but this can be radius too, and it can be radius in the neck. Let's talk about that for a minute.
Yeah, that's awesome. We actually did a really great patient today, and it really helps with like that crepiness, the skin texture, and again, it's one of those that you're not going to see immediate results. I mean, we do what Dr. Barrett calls get like the fake results, because have a little bit of that post treatment inflammation, but really about 4 to like 6 weeks after, you compare the before and afters, and it's just amazing
It's
results.
kind of that gift that keeps on giving.
Yeah.
I mean, it does.
Because it's going to stimulate your own collagen production, so it's using your body's own tools to get better. So, I mean,
and then if you combine it with something like the alt therapy or, the cool laser, it's just, I always say, and everybody's heard me say this a million times, 2 + 2 is 6.
Yeah.
I mean, in our practice, because, you combine alt therapy, you combine a little radius, you combine a cool laser, and you can get all these things. And, we're in difficult times, so not everybody, even in the good times, not everybody can come and do all that at once. So it's important that.
But it's not a race; it's a journey. So it doesn't have to all be done at once. We can just create a nice treatment plan and take our time with it. Get you there.
Yeah, it's really this is another alt therapy. Again, low face, neck, never just neck alone.
But these millennials, they have it all figured out, because they always come in wanting that really just.
I know. I think back. I always had the big round baby face, forever, and it's like, and the double chin, and I'm like, God, if this stuff was
out.
If I had this when I was like, in my 20s, oh my God.
I know.
I would have that heart-shaped face that I wanted, like everybody else. I wouldn't have that under there. I mean, it would have been.
I know.
So fun.
Don't worry, me too. I have the big round face too. My husband says I have chipmunk cheeks. Like, thanks.
This
what I want to hear.
Man is he's like a little boy. I mean, he was very young when he came to me, and he just had that genetic, fat under there, and he's been like the happiest guy.
Yeah.
And when we see him, he's just coming back for his Botox. He doesn't need this anymore.
Yeah, he looks fantastic.
An awesome chin. So
look at that.
Yeah. I mean,
it's amazing.
He really was so happy, and he
I bet it boosted his, ego and his, absolutely.
And he started exercising more because he looked better, he felt better. We say at Renew, when you look good, you feel good.
Absolutely.
It's so true. It's like these times when everybody's stressed out.
Yeah.
A lot of people come in just to get, looking refreshed.
Yeah.
I mean, nobody's going to a ball, but they want to look good.
Absolutely.
This is one of my patients.
Wow.
Yeah, I don't like to talk about her because she actually had one treatment of DCA.
Oh,
and she
wow.
was like this.
It's amazing.
It's amazing.
That's a rarity, but it's amazing.
It's a rarity. So I don't want any of you to think that's going to happen, because usually it's 2. That's why we sell it in packages of 2. She actually did the second one anyway, because you could still pinch a little bit. But I mean, oh my God, just amazing results.
Oh,
this
wow.
is another one.
She looks like a different girl.
Beautiful.
Yeah, it's amazing.
Like I said, I wish I could have done that when I was young.
I know.
So this is somebody, you know, sometimes it's not right under the chin. It could be just the jowls. See that a lot. So, you know, when we're doing radius, if I can't lift that jowl with the radius alone, then it's going to get a little
DCA popped in there.
Little bit. We have a different price whether it's for the whole under the neck or whether for the
small little
jowls.
area.
And it's really not a bad price for permanent fat reduction that is, you know, amazing. So Phil, we're going to go on to Phil. So we've only gotten through firm.
I know.
We're talk about Phil. We're going to get our little mark when it's been 30 minutes. So we're not going to talk all night, don't worry.
Although we probably could.
Yeah, we could. So we kind of talked about this though.
Yeah.
We talked about our radius. We talked about our renew lift where we're lifting everything up. And if you put enough filler in here, like I said, you almost don't even have to lift under the neck.
Right.
It just kind of sucks up. You know, there's some patients though have a full face and you can't put enough in there.
Yeah.
And that's where then we do all therapy because it lifts without volume. But radius there for the neck is great.
Mm-hmm.
And I think sometimes it's confusing to patients because
Yeah.
they come in and they go, you know, my neck really bugs them. And I'm like, radius.
Yep.
Like, what's that about? But it's all about this. And I'm like, do you ever do this in the mirror? Well, do this and look at your neck because it looks better.
Yeah.
And then those necklace lines, the tech neck.
Oh, the tech neck.
It's
because we're all like this all day long.
Yes. Your generation is
I know,
even
ours is
starting
going to be
get
horrible.
Their thumbs, they're going to have thumb arthritis and tech necks. So,
or beefy thumbs.
Yeah, they're going to have thumb arthritis. I've seen my daughters. Thumb arthritis for sure. So this is a radius jawline. Beautiful.
Gorgeous.
This is Karen Leone. She's actually our permanent makeup person, and she's amazing. I gotta have her do my eyebrows. Now that everybody's behind their
I know.
masks.
All you see is the eyes and the eyebrows. I have my mom to thank. She never let me pluck my eyebrows back in the 90s. So.
I never plucked mine either. So they're doing pretty good.
Yeah, yours look great.
Use a little more. So she had, and you look at under her chin there. If you look under her chin, you can see how where we did that radius, it like sucked that up. That wasn't DCA, it was just radius. So it's awesome. You guys are quiet tonight. Ask us some questions. So this is another radius for neck and jawline. So if you look under her neck, I mean, it's just so much cleaner.
Yeah.
You know, it's not like a big amount to
It's not
suck up,
choppy.
but it's like beautiful. And when we do that, when you lift, it's like look under her eyes. It's pretty.
Yeah, I always find that that's where you see like so much of like the dramatic results. It's just in their eyes. Like you can't pinpoint exactly what's going on, but you just see that they're just so much brighter.
It's the eye looks at when you do one side and you show the half and half. It's like you see that eye pops, and it's you know it's not like you put anything under that. It's just pulling it up, giving support, and it frames it. It's framing your eye. When you lose volume out here, your eye's not framed as well. So this is
awesome.
Bellatero, we've got, you know, those little necklace lines, instant gratification, you know, one syringe, easy, doesn't even hurt. And finish, we're going to get rid of the spots on the giraffe. So we've got microneedling, which is, you know, it's kind of like a poor man's laser kind of thing.
For sure.
We did a lot of microneedling before we got the laser. We don't do as much now, but it's still a great tool.
But I think it's a great option for a lot of our younger patients, you know, because maybe, you know, either financially can't, you know, with the laser, or really, I mean, it's a pretty aggressive treatment for somebody maybe in their 20s or, you know, that doesn't have anything aggressive but is still looking for some kind of improvement because, again, we're all looking down in our phones and on computers. So this is a great option, and you know, pair that with PRP, it's going to be fantastic.
So we have a question.
All right.
How can you tell if your problem is excess fat or just skin laxity issues?
Okay, that's an excellent question. Wow, love you.
I
You
know,
must have
that was
gotten into our brains. So do this. Take your hand and just do this. If you can pinch it, and sometimes you can pinch in laxity too, but if you can pinch something there and it feels rubbery and full, it's usually laxity. But usually, you know, a lot of times people have to come in. When I was I think the first person on the Treasure Coast to do, what is it called, Kybella. And I had a lot of people coming in thinking they needed it. And, a lot of them really just had loose skin. So that's laxity.
Yeah.
So really we pinch it, and it's a feeling of fullness and kind of rubbery. If you can pull, the other way is if you can pull like this and it goes straight flat, then it's usually not fat, it's just laxity. And so those two ways. So pull here and pinch.
It also pinch your tummy. A lot of us have a little bit of that fat, right in our tummy, and you can kind of get the feel because we know this is not extra skin, this is a little extra fat. So you can kind of compare the feel, between the tummy and this area.
Yeah, that's a great idea. I never thought of that, but because we know what
it feels like, right?
We know the difference, but for you, feel your tummy or where you've got a little fat roll.
You can come feel mine. I got plenty for you.
So our other neat thing we can do, so microneedling we can do to stimulate the collagen and help with that creepiness.
Yeah.
The neuromodulators, so the Botox disorders, even if you've got a neck band, it'll just lay it right down.
A lot of our really thin, very active runners, they really start to see those bands, and they're the ones that are the most obvious. But most of us do have it. But for sure. You guys feel those guys.
If you see little bands, then we can shoot them up and lay them down. So the other thing, skincare, and that's super important. So we have some great neck creams. That's a great rejuvenation.
Yeah,
so,
absolutely.
You don't need a microneedling or a laser or anything yet. Use skin cream for your neck and sunscreen.
I mean, we take that for granted so much when we're younger because we just look nice and we look youthful and we don't really see the damage at that time. But then when we start getting into our mid to late 30s, 40s, that's when you really start to pay for all the sun that you kind of abused with.
I'm feeling very guilty because I have to say I am really bad about, I forget my neck. I'm really bad about it. I've been taking great care of my face since I was 38 when I got in this field.
Yeah.
And I just am not good about my neck.
And I think most people aren't. They really just kind of forget it. I mean, I think I'm pretty guilty too. I'm always.
Right. I'm going to make a vow to you all. If you're all going to take care of your necks, I am too. Let's shake hands. Let's make a pact. We're taking care of our necks. Okay? All right. We have a question.
Yes. Do you need an appointment to get the skincare line?
No, you do not. We have great estheticians. We have Diana and Stuart. We have Kate down here. And actually both Tiara and Annie, my front office coordinators, everybody's versed in skincare. You come in and we have our Renew Skin line, which is amazing. It's basically brand name products, but they're put together just for you. So we have Renew Skin Acne, Renew Skin Neck, we have Renew Skin Rejuvenation, Renew Skin Pigment, Renew Skin Pre-Procedure. So in other words, come on in and no problem.
Yeah, we can get you set up. You tell us what your main concerns are, and we'll get you set up with a nice skincare regimen. Yeah.
So we've got our secret code is balance. Don't forget. So in the next 24 hours, just call. And actually, if you call the office and leave a message right now, then even if tomorrow you forget to call to get your discount, they'll take care of you. Yeah. So as long as you touch base with us, within that time. So call and leave a message, direct message us, text us, whatever. We're there. And Renew Skin, the Renew Cool Laser we've talked about ad nauseum. So that's another way to finish things off. This is actually a microneedling before and after.
Pretty amazing.
So really nice, has increased the collagen, boosted it. We talked about the neck bands a little bit. That's all the areas we can put our neuromods, but neck band, don't forget. It's really easy.
Actually, one area that we didn't really even talk about is the masseters, which really kind of ties into the jawline.
Thank you.
Thank
you. My God, I've been shooting masseters up and down all the past couple weeks. It's been everybody and their mother has needed masseter. So we're talking about the muscles here.
Sometimes you get them from grinding your teeth at night. Yeah.
TJ, some of my patients, I say, bite down and they go, boing.
Yeah.
And it's a couple things. So it can get rid of headaches. It can get rid of that tension back there. Aesthetic medically speaking, which is why it,
That
why it ended up
jawline.
in our genre, is because of that. And I actually have my dentist sends me patients sometimes with that,
Yeah.
And what it does is it will relax that and it will thin
Smooth
that
out,
jawline out, makes it for an
This
even
is big
better-
on, all kinds of patients, but a lot of our millennials, we're finding it a lot in the younger patients. And like she was saying, back in her 20s, she had this little round face. But we find a lot of patients, it's really just their masseters are so large and so strong that you just relax that muscle a little bit, and there you go, you get that heart-shaped face, and all it took was a little bit of Botox
Yeah,
or
so
Zenith.
usually I do like 30 units, 15 on each side, but everybody always has one that's bigger than the
Mhm.
other. Kind of divide it between that. It's usually like 1, 2, 3 shots, boom, and you're done. And the funny thing is that a lot of my patients tell me that just when they have that shot, they feel it immediately.
Almost immediately.
It's not the neuromotic working, but I really think it's the needle going in there.
Yeah, like an acupuncture.
Like an acupuncture,
Mhm.
yeah, exactly. So this is just where we would put, like for the neck bands, we put it to kind of just lay them
Relax
down,
them,
and it
yeah.
works great. So the Renew Skin Neck is basically our neck cream and sunscreen. It's two items, and that's it. And then you get a little discount when you buy these packages of products. So these are just some little combos. We've kind of talked a lot about different combos. And so I want to just kind of wrap it up, and then we're going to let you all go to dinner, your martinis, whatever you're doing. So we talked about our firm fill finish. So firm, we've got the DCA Fat Buster, we've got the Alt Therapy to lift you, we've got the Renew Cool Laser. So all these things, if you call in the next 24 hours, call now. I feel like an infomercial. It's 10% off if you call. So
No, but seriously, call now.
yeah, seriously. Call right now. Leave a message for Tiara or Annie. It's 888. No, I'm kidding. So you can fill the necklace lines with Bellatero. You can fill up with radius or hyperdilute, what we call radius on the neck. And then finish is the microneedling, the laser, the Xeomin or Dysport or Botox.
Right.
And our Skin Better. We've got our
Skincare.
skincare. So that's it. That's all we
And
got.
really, one last thing I'm going to say is the biggest thing is if you have any questions or just come in and see us. We do free consultations, and what better than to get, a little bit of one-on-one time with one of us and really kind of come up with an ideal treatment plan for you. So, it doesn't hurt. It's not going to hurt you. It costs you anything. Just come see us so we can,
Free consultation.
yeah, absolutely.
And we've got, both offices are open 5 days a week in Stewart and Tequesta, so we're right here. Do we have a question?
Yeah, Amber says she misses you very much.
Thank
Miss you too,
watching us, Amber. Mwah. We miss you. Hugs. Aw, hope your power came back on.
I know. Sweating over there.
All right, you guys, we are signing off. Renew Medical Aesthetics, Jamary, Dr. Barrett, and we can't wait to see everybody and balance you out with your next
Right.
jaws.
Thanks for tuning in, and leave some remarks and let us know what you guys thought and maybe what you guys like to hear from us next.
Yeah, definitely. And
We'd
if
love to hear
5
from
of
you
you want to
guys.
come
Oh,
in
yeah.
next time,
Absolutely. We'd love to
be
have
our
you
little
this time.
VIP audience.
Maybe we can have some champagne then.
Of course.
Bye.
Bye.